Hello, my name is James Baker, and I'm an attorney. My wife and I have 3 adult children. When the kids were younger, sometimes they would ask my wife and me financial questions, for example, about insurance or home mortgages, things like that. And we were comfortable asking and answering those questions because we had lived through situations involving insurance or mortgages, things like that. But now our kids are at the stage where they're beginning to ask us questions about healthcare plans. And my wife and I are no longer confident with our answers because the whole environment of healthcare in our country seems to be changing right now. So, at a point like this, I turn to a good buddy of mine, Mike Chandler, who is the owner and founder of Dogwood Capital Management in Fayetteville, North Carolina. And I asked Mike if he can give me a little bit of a framework to help me understand better where we are in this country today with respect to healthcare. Mike, as I said, I'm an attorney by training, so when I look at a situation, I tend to focus first of all on the issues. What are the issues, or what is the problem in healthcare today?
Well, the single biggest problem in healthcare today is our cost on a per capita basis here is extraordinarily high.
Here, meaning the U.S.?
United States, yes. We spend a little over $8,700 for every man, woman, and child on health care every year here in the United States.
Seriously?
Yeah.
How much do other countries spend?
Well, the average of the OECD countries is a little over $3,300.
That would be the developed countries?
Yeah, basically the top 20 developed countries.
So we spend more than twice as much here as other developed countries spend.
Absolutely.
Per person.
It's crazy.
Why is that?
Well, there's a lot of reasons, but let's start off with the pharmaceutical area. What I'll try to do is break this down in multiple pieces, but let's take a look at pharmaceutical needs. Here in the United States, we spend a tremendous amount on drugs. Just to give you a reference point, Lipitor, which is a drug that manages cholesterol levels. It's a very common drug. Here in the United States, the cost of that drug is $100 a prescription or for a month's supply. In France, it's $48. England is $43. And Spain is $22 for the same drug.
Are they subsidized by the government over there, or what?
Well, one of the things you got to remember, of the 22 countries that are in the OECD, and I could use that reference, and we're using that today because a lot of the statistics that I got are coming from that. But the G20, most of these countries, in fact, all but 2 of the 20 OECD countries have universal health care. What is that? Well, it's kind of like our Medicare here.
Single payer
systems. And they negotiate with the pharmaceutical companies as far as what they can charge for specific drugs. And overall, they pay half of the cost of what we pay here in the United States. It's sort of funny, when we just, none of this is funny, but we take a look at Canada, for instance. There's a lot of folks wanting to go into Canada to get their prescriptions filled. Why? I just explained it. And they won't allow them, by the way. I mean, it's very difficult to do. Now, universal health care means that those prices were negotiated. Well, let's talk about how complex this is. Yes, pharmaceuticals are twice as much here than they are abroad.
But it's not the same everywhere in the U.S., is it?
Pretty much, and I'm giving you averages, country averages.
But I mean, isn't the price at one pharmacy a little different?
Well, now there's a whole new question. Unfortunately, I have a high blood pressure issue, and I am on lisinopril. Well, if I go to the major drugstores, and I won't name them, but if I go to the major drugstores, that prescription is going to cost me about $30 a month for lisinopril. It's been around a long time. That same drug at our largest discounter here in the United States is $3 a month.
$3?
Yeah, the same prescription. And that discounter actually has 300 frequently used medicines that are priced at $3 to $4 a prescription.
When it comes to that discounter, we can get specific, can't we? I mean,
Yeah, well, that's Walmart. That's Walmart.
Yeah.
Yeah, it's Walmart.
Walmart is 1/10 the price for a 1-month prescription of lisinopril as some of the big name pharmacies.
Absolutely.
Wow. How can they do that?
I don't know. It is what it is. I don't know if they can buy the prescriptions in bulk so that they're so low, but if that gives you any indication of the markup that we have, that's quite a discrepancy between the two. I wish my business had those kind of margins.
Wow. So is it across the board in other medications too?
Well, they have a list of about 200 drugs, and designed for various different needs, but pretty much basic drugs.
What about some of the other pharmaceuticals that you hear commonly advertised on TV, like, for example, Celebrex or Nexium or something like that?
Celebrex and Nexium is absolutely crazy. Again, when I compare it with the rest of the world, there again, we take a look at Celebrex here. It's $225 average here for a month's supply of Celebrex.
The nationwide average.
That's the nationwide average. Yes, in Canada, that same prescription is $51.
That's incredible, Mike.
Yeah, it's pretty astounding. This is part of the problem, but it's not just that simple. And let me try to explain to you why we touched on why we have universal health care, and these countries that have that negotiate the price. Well, pharmaceuticals, to take a drug from step one in the FDA process to a sellable product, it costs $2.69 billion.
You mean to research and develop
R&D, the whole process,
and get approvals for a new drug?
Absolutely. And that doesn't count the fact that for every one drug that gets approved, there's 10 that started in trials, in phase 1 trials that never made it. Mm-hmm. So they've got a huge cost in developing these drugs. And what's happened with the governments negotiating prices abroad, it's put the ability to recapture that really on the backs of the Americans. Recapture that 2.69.
In other words, the pharmaceutical companies need to recover their costs so that their shareholders get what's coming to them.
Certainly.
And the only place to do that is in the U.S.?
Yes, because our prices aren't regulated.
Wow. But in the context of healthcare, pharmaceuticals, that's only one part of healthcare. Mm-hmm. What about procedures or lab tests or some of those other things a doctor might prescribe for me?
Well, let's start off with lab testing, okay? A simple procedure, a lipid panel, okay, which is a very demanded procedure.
Sure.
Here, if the doctor orders that drug or that test and will handle the billing of that test, the billing for that test is going to charge that doctor $15. The company will charge the doctor $15 for the test. Now,
here in the U.S.
Here in the U.S. Now, if that same procedure is done and it's run through insurance or the independent payer, the average cost is $93 for the same test. Something's wrong with the system there. Now, why is that? Well, to process things through insurance companies is expensive. And, we'll get into ACA and the difference between private health and universal health care and the cost of administration, but it's significantly higher. Is that enough? I don't know. I don't know the answer. There's probably some greed in there, and doctors may very well be marking those products up, which I'm sure they are.
Okay, so you've talked about pharmaceuticals and about lab testing and that type of procedure that could be prescribed by a doctor. But let me just ask you, do doctors sometimes, or medical facilities sometimes, raise their prices in anticipation of litigation costs, malpractice lawsuits?
That's a great statement. Let me tell you this. Let's take the cost here in the United States. And I'm going to pick on C-sections because we're going to talk about that specialty in just a minute. But the cost of a C-section here in the United States is a little over $15,000 for a C-section here. That same cost in Australia is $10,000, and in Spain it's about $2,200 for a C-section. Well, here in the United States, we perform 33% more C-sections than anywhere else in the world.
Why?
Let's talk about OBGYN doctors and what they're faced. These obstetricians are an area that has been earmarked for litigation. The cost of malpractice in this specialty is anywhere between, malpractice insurance is anywhere between $85,000 and $200,000 a year for these doctors to carry. It's a big cost.
Yeah.
Well, the fact is, in fear of litigation, a lot of times they'll revert to having a C-section done because delivering a baby that's breached is more apt to have problems than it is a C-section. So a lot of times they'll elect to do a C-section versus a natural birth. They're less likely to be sued.
Wow.
And many of these specialty doctors in this field, many of them have elected not even to carry malpractice insurance today.
And the only way to do that is by jacking up your charges, right?
Yeah, absolutely. And that theme is everywhere. We take a look at basic procedure. Let's take an appendectomy. Hospital and doctor combined cost for an appendectomy here in the United States is $13,900, average cost. That same cost in Switzerland is $9,800 and $2,200 in Spain. Now, you touched on a very good issue, and this is one of the issues that we've all got to address, is doctors are afraid of litigation, and as a result, they're ordering a lot of unnecessary tests. And what you'll find out is the culture here in the United States is different than much of the rest of the world. First of all, because the cost to deliver our medicines or our health care is so high, we don't go on a regular basis. We don't go have our annual physicals. We don't do wellness at all, to speak of. We wait for us to have an issue, and then we go to the doctors, and then naturally they refer us out a lot of times. But a lot of times they'll refer stuff out they'll refer specialty testing out just to cover themselves.
So, Mike, basically, what I think you're telling me in answer to my original question about the issues in healthcare, the impression I'm left with is that there is no one solution. It's a bunch of interlocking problems that would all have to be changed for us to have a better healthcare system, or for us as individuals to have a better grasp of the healthcare situation.
I think it's knowledge. Sometimes it's mask. Let's take a physician visit, a doctor visit, or with your family practitioner. The average cost of that is $68 here in the United States for go to your general practitioner. Now, in the rest of the world, it's $30. But here's what we see. We pay a $30 or $40 copay. And we view that as, mentally, we see that in our costs as $30 or $40, which is not too bad. But we don't realize that the insurance carriers are picking up the rest of it. And we're paying for that. We're paying that through our premiums.
Yeah.
And you talk about pharmaceuticals. Most of those are $5, $10 copays for most of those drugs that I talked about. Well, all of a sudden you've correlated, my lisinopryl's costing me $5. So what's the deal? No, the insurance company's carrying the rest of that, which you are paying for through your premiums. So we don't really get a good grasp of the cost. And I think here in the United States, we need to get focused on what the real costs of these things are. And I think that goes on the onus of the individuals. And there's a lot of other issues, but that's just one of them.
Wow. Well, I've got several other questions that I want to ask you too, but I think you've given me a little bit of a better understanding right now about maybe the central issue, the way costs vary around the world and from provider to provider here inside the U.S.
There's a lot of issues. Let me give you one more. Actually, two more points I want to make. You remember when ACA was being discussed in Congress and before it was...
The Affordable Care Act.
You remember the issues of death panels?
Yes.
Well, when I heard that was appalling, and it is appalling. I can't imagine if you got an opportunity to save somebody's lives as you don't. And that's the mentality and culture of us. But let me share something with you. Here in the United States, the average annual cost for medicine or for health care for an 85-year-old is between $40,000 and $45,000 a year.
Wow.
That same age group for health care cost, the next closest to us is Germany, and it's $10,000. What's that telling us? Well, it's telling us basically here in the United States, we do extraordinary measures to preserve life at that age. Not making a call on that culturally. My mom's 83 years old, and I want her to be with me, till she's 200, and I want that. But that is a huge contributory cost to our cost of health care. Age 90 is the fastest growing demographic in this country. Age 90.
So you're saying that from an accountant's perspective, it would be advantageous economically for older people to die off sooner.
Wow. You're going to make me make that call?
No, I'm just trying to...
there you're crossed to a point where it's an ethical issue. Getting back to my point, though, that age group is the demand on that going forward is going to be huge because you got 74 million baby boomers that are going into retirement. Age 90 is the fastest growing demographic. So our expenses, the point I want to make is our expenses are going to increase significantly in healthcare. Case in point, right now, 17% of our GDP is spent on healthcare. We project in 10 years that number is going to be 28% of our GDP here in the United States. It's running away from us, and that is a huge issue. And when I did the research for all of this information that I'm giving you, I thought, like probably many folks would think, but we got the best healthcare system in the world. And I said that to myself. And I said, maybe I better check. Mm-hmm. And I did.
But the problem is, what do you mean when you say best? What about the quality of doctors?
Yeah, I thought when I define best, I think of, we got the most up-to-date scientific stuff, and we deliver it efficiently and fast. And, I heard the horror stories about getting procedures done in Canada. Y'all have heard those.
Waiting lines?
Yeah, waiting lines for procedures, et cetera, et cetera. So efficiency is certainly one of them. The equity is one of them. And output or outcome is another measurement. And Commonwealth Institute was mentioned in an article it was in Times. And out of the top 11 countries, developed countries, the United States ranks dead last in all three of those metrics. That's scary.
In Say again the three metrics.
Efficiency, equity, and outcome.
How do you measure doctor quality?
A number of physicians per capita
Okay.
is one measurement. You know, our life expectancy here in the United States is below what it is abroad. In all fairness, though, some of these numbers are skewed. For instance, when you take mortality rates for infants, our measurements are different than others. And, you know, we take a much harder look on our own than the rest of the world does. So some of these are skewed. But this was a huge study done, and I've correlated with other studies too. And they all say the same thing. You know, our total healthcare system is not as good. So what I'm telling you is we are twice the cost of everybody else in the world, and at the same time, we're not delivering the top product.
All right. Well, thank you, Mike. I appreciate a very thorough answer to my question.
Great.
I've got some more questions for you as well, but maybe we should save those for another time.
Well, we could certainly do that. I would like, some issues that I'd like to discuss as we go forward would be, I want to take a look at the Affordable Care Act. As you know, I spent a great deal of time of that and traveling the country and talking about Affordable Care Act. But it's been around since, it was voted in 2010, but not really fully acted until 2014, and we've had a couple of years of that. I'd like to talk about that at a later time, and I think, maybe next time we could sit down and we could take a look at the Affordable Care Act, and maybe we'll take a look at Medicare and universal health care, as well as other alternatives, because, being a capitalist that I am, I'm so afraid that if we ever tried anything like these other countries, we would give up a lot of very, very good R&D that has taken a lot of very serious sicknesses to the brink of being cured.
All right. Thanks, Mike.
Thank you. It's good to see you, James. Thanks.
Likewise.